Namaskar. Welcome to Jaycee Talk, a premier program of JCI India. I am Dr. Nirmalasaravanan of JCI Pondicherry Lighthouse. Menstruation, bleeding, periods, sanitary pad, menstrual cycle. Shh, don't say it loud. Speak slowly. At least use words like those days, Red Sea, bread jam, moon days, shark days. Nearly 800 million population are menstruating. 50% of the female population are menstruating. Only a handful of species menstruate and women are one among them. When menstruation is a normal biological process, why is it always spoken in silence? Why is it a shame to speak about menstruation? Because of the widespread stigma and taboo related to menstruation. Many cultures don't allow women to enter into spiritual places. They are not supposed to perform spiritual activities, touch the holy book. They are not even allowed to enter into the kitchen, cook food with the belief that the ray or the smell they emit during menstruation can spoil food. They are not allowed to touch milk, pickle, crops and even flowering plants. Cultural norms and religious beliefs are often compounded by the traditional association with evil spirit. It is believed that women bury their clothes during menstruation to prevent being used by evil spirit. There is a belief that menstrual blood is dangerous and it can cause harm to a menstruating girl or a woman by using black magic. If a girl or a woman touches a cow during her periods, it is believed that the cow can become infertile. There is also a belief that if a girl or a woman during her periods touch a man, it can cause ill health in the men. A study in Egypt shows that girls during their periods are not allowed to take bath because of the taboo, not to touch water. Similarly, a study in Nepal shows that women and girls are made to sit in a hut called menstruating hut during their entire periods. They are also made to sleep in the fields or in a cattle shed. Women and girls have to undergo purification before they enter into the family and perform their daily chores. Even advertisements show blue gel instead of blood because of the taboo. When we buy pads from the shops, we wrap it in many covers to hide the pads. Why is it so? What can be done to overcome all these? Let's talk. Speaking openly, talking in the public, bringing awareness can overcome these problems. What is menstruation? A girl, when she is born, there are thousands of eggs in her ovary. These eggs wait until a time comes. A hormone called follicle stimulating hormone stimulates the ovaries and make the follicles to mature. An egg is released from the ovary. It enters into the fallopian tube and waits for fertilization. When it meets with the sperm, fertilization occurs. Meanwhile, the endometrium gets ready to receive the fertilized ovum. It is rich in nutrients to receive the fertilized ovum. When fertilization doesn't occur, the endometrium, the unfertilized ovum with its products come down as menstruation through the vagina. When a girl experiences this, it is called puberty or menarche. Menarche is a period of transition of a girl to womanhood. Menarche is a milestone in a girl's life as she develops the reproductive capacity. During puberty, the body grows faster and undergoes a lot of changes. The breasts develop, the axillary and pubic hair grows, the body develops a curvature, pimples develop in her face. Puberty can be both challenging and confusing. Emotions fluctuate during the time of a period. A girl, whether she faces the puberty with fear or with celebration, depends upon the awareness and education she has obtained about the periods. This is a cycle, and this menstrual cycle takes place in a woman's life from the time of puberty till menopause. Menopause is the cessation of menstrual cycle. Menopause is a point of time of 12 months when the periods has completely stopped. Due to the withdrawal of the hormone estrogen, there are a lot of changes in our body. Hot flushes is the sudden feeling of heat in a face or throughout the body. There is a lot of weight gain, joint pain, memory loss and mood swings during this menopause. Women experience mood swings and depression. The periods are irregular. She experiences 2 periods in a month or a period which lasts for more than a week. She is spotting, heavy bleeding during menopause. Menopausal women has to undergo a lot of lifestyle changes. They have to include lots of fruits and vegetables in their diet, avoid sugar, salt and fat in their diet. Caffeine should be avoided. She should quit smoking. She should go for a walk for at least 30 minutes in a day and practice healthy lifestyle. A girl from 9 to 16 years, if she attains a puberty, is considered normal, and menopause occurs from the age of 45 to 50. This is a cyclic process and occurs every month, every 28 to 35 days. During the menstruation, women experience a lot of physical and emotional changes in her body. Premenstrual syndrome is a group of symptoms which occurs before her periods. She experiences tenderness in her breast, cramps, pain, mood swings, anger, anxiety and depression. This is because of the hormones secreted during the periods. This can be overcome by simple exercises and good nutrition. There are many issues related to menstruation: irregular periods, painful periods, heavy periods. What is irregular periods? Why does this happen? Irregular periods is a period which happens between 28 days to 35 days is considered normal. When the periods are longer or shorter, when it happens in between, it is called irregular periods. When a girl attains a puberty, these periods can be irregular for 2 to 3 years, and this is considered normal. When a woman is experiencing menopause, the periods can be irregular, and that is also normal. But periods when they are irregular in between, it might be because of a polycystic ovary, anemia and many other causes. A woman should meet a gynecologist if she has irregular periods regularly. What is heavy periods? Heavy periods is a periods prolonged for more than 8 days, or a pad when it is saturated within an hour with a lot of clots during the bleeding. A gynecologist should be seen immediately if there is heavy bleedings during period. What is painful menstruation? Dysmenorrhea is another name for painful menstruation. If the pain is very mild, then it is normal. If it is very painful, if the normal activities are affected because of the pain, then the girl or a woman should meet the gynecologist. Global attention is given to the importance of periods. A group of experts of Global Menstrual Collective has defined menstrual health as a state of complete physical, mental and social well-being, and not merely absence of disease due to menstrual cycle. A woman's health has to be taken care during her periods. She should be psychologically supported, emotionally cared during her periods. Let's talk about menstrual hygiene. Poor menstrual hygiene can lead to many diseases. It can cause reproductive tract infection in a woman. Reproductive tract infection can lead to infertility and birth complications in the future. There are many menstrual products available in the market. There are sanitary pads of different sizes: small, medium, large. A woman or a girl can use it depending upon the flow of her periods and her body build. There are menstrual cups available in the market. The menstrual cups are an easy product which can be used by a woman. There are 3 sizes of menstrual cup: small, medium and large. Depending upon the body build of a woman and a flow of period, she can select the menstrual cup as needed. Tampons are also available which can be used conveniently and comfortably. But a woman, when using the tampon, should be aware of placing the tampon and removing it safely. Otherwise, it can lead to toxic shock syndrome. Reusable menstrual pads are another product which can be used for menstrual hygiene. Reusable menstrual pads are another product which can be used comfortably by a woman during her periods. It absorbs blood and holds it safely. It has a panty lining which can secure the pads safely. It is very soft and comfortable. It can be washed and reused many times. The pros of a cloth pad is it can be reused many times. It is economical. It is environment friendly. The cons of the reusable pads are it cannot be used during heavy bleeding and it cannot be used during travel. Also, washing the pads with the hands to remove the stain and to dry it is a problem. There are many complications related to poor menstrual hygiene. It can lead to reproductive tract infection, urinary tract infection, cervical cancer, and toxic shock syndrome. Use of hygienic menstrual products can prevent this. How to take care of ourselves during the menstrual cycle. How to practice menstrual health. Washing hands before and after changing pads. Changing pads regularly, 4 to 6 hours whether soiled or not. Washing the perineum from front to back to avoid contamination. Taking bath regularly. Wearing clean clothes. Using clean pads. Wrapping the soil pad in a paper and throwing it in the dustbin safely. Open pads should not be put directly into the dustbin because it can cause many diseases and also pollute the environment. Good nutrition is very important during periods. Taking a balanced diet with plenty of fruits and vegetables, avoiding sugar and sweets during periods, drinking lot of water, performing mild to moderate exercises, taking adequate rest. These are to be followed during the periods. Girls and women should follow this and take care of themselves during their periods. Globally, 2.3 million people lack basic sanitation facilities during their periods. Only 27% of the population have adequate facilities to wash their hands with soap and water during their periods. Even homes are not provided with adequate facilities for hand hygiene during the periods. Women and girls with disparities and disabilities are more affected because they are not able to manage their periods with adequate toilet facilities and materials to manage during their periods. How can we promote menstrual hygiene? Girls and women should be health educated about menstrual hygiene. They should be openly spoken about menstruation, use of menstrual products, and disposal of menstrual products. The ill effects poor menstrual hygiene can bring among them. They should be provided with adequate sanitary pads to use during their periods. Women and girls should be provided with toilet facilities with adequate water so that they can frequently change their pad during school and in workplaces. Women should be provided with facilities to safely dispose their used pads. Let's talk, bring awareness, promote menstrual hygiene. Let's put a full stop to the silence and shame related to periods.
At this juncture, I would like to thank our JCI India National President JFS Anshushara and SDC Chairman JC Vaman Kumar and his team for giving me this wonderful opportunity. Thank you.